Hi everyone, welcome to Research MD. This is Dr. Pramil Chariat. I work as a Chief Medical Officer in the United States, also an Associate Professor of Medicine in one of the large medical schools. Today, we're going to continue our talk about the physician mistakes. The reason we're doing this talk is the mistakes we make have have a lot of serious effects on the patient care. When we make mistakes or something happened to the patient, it put a trauma to us, right? People usually get depressed, they couldn't sleep at night for a long time. Also, the financial impact is also very important, right? When we make a mistake, most of the time is detrimental to the patient, and the lawyers get involved. When the lawyers get involved, it's a different story, okay? You can get dragged in the court and you could lose a lot of money. If the money is gone, no honey. That means if there's no money, your wife is going to leave you. So we're going to talk about this physician mistakes, okay? Today we're going to talk about an important topic is the compartment syndrome. If you do me a favor, just go to the Google search and type physician mistakes. The number one thing you're going to find, a patient came with the compartment syndrome, orthopedic did not detect it on time, and it took a while for them to diagnose, I think 4 to 8 hours, and the patient ended up having a serious damage. And the verdict was $111 million, my friend, okay? So it's a huge amount. So be very careful about compartment syndrome. So anytime patient come in, what are the main thing when you talk about compartment syndrome? Look at the signs. There's 6 P's involved here. One is, everything starts with the P, right? P for pain, P for pallor, poikilothermia, pulselessness, paresthesia, paralysis. Okay, those are the 6 P's. When we talk about the pain is usually out of proportion to the presentation. Severe pain. But sometimes it might not show up. Also, you have to be careful about all the 6 P's and the risk factors. So some scientific studies have looked at the risk factors, okay? If the patient is a male, it's obesity, polytrauma, multiple trauma involved, and high pressure injuries, and short skirt 3 and 4 fractures. That's usually the tibial fractures, and it can be type 3 or type 4 like medial and the lateral platotibial fracture. So most common is the lower leg, but you can have the upper extremities also. So if the patient is male, obesity, multiple trauma, high pressure injuries, tibial plateau fracture, be careful, most likely it'll be compartment syndrome. So how do you check for it? It's only one thing to do, my friend. Call orthopedic right away. They can come and do the surgery or measure the compartment pressure, and also make sure you check the CK, okay? Again, the whole purpose of this talk is about to avoid physician mistake. Everybody make mistakes. You're going to make mistakes, and I'm going to make mistakes. But let's learn from this mistake, so there's no patient compromise, and we also we don't lose any money to the lawyers and the other people, right? So be careful, my friend. Thank you for watching. We'll be back with another presentation. God bless. Please subscribe to our channel. Thank you.